Everybody, and thank you for coming. Our goal today is to give an update on our numbers in Chicago, give an update on the travel order, and take questions. So we can move ahead. If people have not recently visited our updated dashboard, you can go to chi.gov/COVID-, or as always, you can go to chicago.gov/coronavirus, and right up at the top, there's a tab that says latest data. You'll see that this is what the front page of our dashboard now looks like. Right up at the top is the positivity rate, and specifically, that's the test positivity rate. So this is calculated the same way that the state is calculating positivity. We know we had gotten some questions about the different ways of calculating it, and we've now put that first and foremost on the top of our dashboard. You can also look within the daily numbers to see the person positivity rate. We continue to track that. We use that for decisions about where to put testing resources, but the overall positivity rate for the city is at 4.8% as of today. You can also see the total number of tests that have been done. We've done 625,000 tests here in the city of Chicago, and we're averaging 6,886 tests per day at this point. Finally, case numbers. We've had 61,587 cases of COVID diagnosed, and that gives us a rolling average of 270 new cases per day. This was updated last night, and actually as of this morning, we're up to 273 cases per day on average. And if you remember, we've been talking a lot about that case number per day. We would like that case number per day in Chicago to be under 200 cases per day. We were there about a month ago. But we've been seeing a slow increase in cases. It's not been shooting up like we've been seeing in some other states, but the unfortunate news is that week after week after week, we are adding new cases. And as this number goes up, the risk of having someone with COVID in a given gathering continues to increase. So this is also the number that we've pointed to 400 cases being really a point of major concern for us. So the fact that we've gone from under 200 up to 270 and continuing on the way up gives us significant concern. And I'm going to talk at the end a little bit about what's driving that. So this is our overall epi curve. This is our graph of cases. These are dates on the x-axis on the bottom and cases on the y-axis on the left. And going all the way back to the beginning of our outbreak, what you can see is that in March and April, we had a very, very steep increase of cases. If you compare what that slope looked like in March and April with a very steep slope to what's happening now in July, you can see that the rate of increase has not been anything like what we saw in March and April. However, we are seeing cases increase at about half the rate that they were in March and April. And the problem with that is that where in March and April it might have taken you 2 weeks to get to a particular point, we would still get there with our current case numbers. It would just take twice as long. So we're concerned about this continued increase. If we look at the actual numbers, you can see, our worst day here in Chicago, we had nearly 1,500 cases of COVID-19 reported in one day. Our overall average was at more than 1,000 cases per day back in May. Right now, that 270 number in comparison sounds pretty good, right? We're at about 25% of where we were at the peak. But again, that increase is giving us pause because it's not the direction that we need to be heading. Go ahead. I wanted to just highlight what's been happening with hospitalizations and with deaths. So similarly, if we look at hospitalizations, if you look back into March and early April, that was an extremely steep rate of rise. That's the point where we were very worried about overwhelming our healthcare system. That was the setting in which we were needing to get additional ventilators, get a lot of new equipment out to the hospitals, work on building the alternate care facility at McCormick Place, because if that trend had continued, we absolutely would have overwhelmed our healthcare system. We successfully flattened that curve, and then throughout May and into June, saw a really nice decline in hospitalizations, which has persisted. So if we look at the numbers there, you can see our worst day in Chicago, we had nearly 200 residents admitted to the hospital with COVID on a single day. And our average was close to 175 people being admitted every single day, Chicago residents, to hospitals. Right now, we on average are admitting fewer than 10 Chicago residents to the hospital with COVID every day. And that has been stable. Deaths, similarly, you can see at our peak, we were having more than 50 Chicago residents dying of COVID every day. The average was nearly 50, and in comparison, that has also come down very nicely and remains stable. So right now, we are seeing an average of 3 Chicago residents dying every day. So on the one hand, this is good news, that we are seeing this slow increase in cases without yet seeing any impact on hospitalizations or on deaths. But the concern, what we've seen around the country, is that typically an increase in hospitalizations or an increase in deaths comes later than an increase in cases. Because if we move ahead again, we've talked quite a bit about what our daily case rates look by age in Chicago. This is data just from the last month, and that red line on the top does represent our 18 to 29-year-olds who still, when we break out the cases into deciles of age, are representing the largest group of new cases in Chicago. That's very different than what we were seeing early on, where we were seeing case rates being much, much higher in people over 70, even people over 80, in turn leading to a lot of hospitalizations and unfortunately a lot of deaths. This has now flipped. And so in fact, that dotted line in the middle represents the city's average, our case rate average. And the only groups that are above that average are the 18 to 29-year-olds, the 30 to 39-year-olds, and the 40 to 49-year-olds. All of the people older than that, as well as the children under 18, have significantly lower case rates. And so in that context, where younger people are more likely to be getting COVID, it's not surprising to me that we've not seen increases in hospitalizations or increases in deaths. However, this pattern has also been seen around the country. And while if we look at the US numbers, finally we're starting to see that huge peak flatten out, deaths are very much on the increase. And we think that's broadly because these younger folks in turn are then spreading it to people who are at higher risk for hospitalization and death. So here in Chicago, that looks like people in their 20s or in their 30s spreading it to people, their parents, their grandparents, their neighbors, who may be in their 50s, their 60s, their 70s, their 80s. In turn, that can lead to increases in hospitalization. So we've not seen it at that point. That is obviously one of the most important things that we follow. If we start to see increases in hospitalization, that would mark a point where we might need to take some even more significant steps backwards. But our goal overall is not to have to take steps backwards. And so I wanted to just highlight 2 things. One is related to travel and one is related to social gatherings. So let's look at travel first. As you know, every Tuesday, we release updates to Chicago's travel order. We were at 22 states last week, and this week we are adding only Puerto Rico. So let's talk again about how states come into this order and how they might come off this order. So on this map here, all of the states that are in red are the states that are currently in the travel order. And those states have a rate of 15 cases per 100,000 population per day or higher. So let's put this in the Chicago context. I told you just now that we're averaging 270 cases per day. There are 2.7 million people in Chicago. So that means that an average of 270 cases per day in a population of 2.7 million people means that we are averaging 10 cases per 100,000 per day. All of the states in red are averaging at least 15 cases per 100,000. They have outbreaks that are at least 50% worse than we are here in Chicago. So the yellow states, which you'll see includes Illinois, are the states that now have case rates between 10 and 15 per 100,000 per day, meaning they're on the watch list. They've had increases. They've not gotten to the point where the travel order would apply, but certainly we're keeping a close eye on what's happening. The states in gray represent the states that still have not gotten above a case rate of 10, and that's good. That generally means you're in very good control. You can see that's most of the Northeast. Most relevant for us in the Midwest, Michigan remains in best control. But the three states that are striped in red there, which are Iowa, Kansas, and Utah, have all made progress against COVID. So Iowa, Kansas, and Utah are on the travel list right now because they went over that 15 per 100,000 per day mark. But just this week, they've dropped below 15. And so if next week they continue that progress and they have a second week of being below 15, next week we hope to announce Iowa, Kansas, and Utah would come off the travel order list. And this is how this works. This is not a political decision. This is purely based on the data and the places where the outbreak is in bad control and significantly worse control than it is here in Chicago. So we continue to really emphasize primarily education around this, that those states in red are not safe places for you to be traveling from a COVID perspective. If there is a necessary reason for you to travel, like essential work or some other reason where you've gotten an exemption, you must take extreme precautions. And if you do have to travel, unless you've gotten an exemption, when you come back to Chicago, the expectation is that you quarantine for 14 days to avoid spreading that risk. I also just wanted to highlight that this is not a theoretical risk. We've had many, dozens and dozens, more than 5 dozen last I looked, of confirmed COVID cases here in Chicago among people who traveled to states on our travel order. So I thought I pulled some of the data from just little vignettes from cases, just that we've done case investigations in the last week. And just to give you a sense of that, we have a teenager who went to a pool party with friends. The friends who hosted had just returned from a hockey camp in Las Vegas and later tested positive. We have a woman in her 30s and her parents who all attended a wedding in Georgia, drove back to Chicago, tested positive, later found out someone at the wedding in Georgia had been infected. We have a woman and her boyfriend who traveled to Cancun, Mexico on a short vacation, returned sick with COVID. These are just from the last few days, but we have multiple examples of this. Just again highlighting, travel to these areas right now is not recommended. Finally, I wanted to highlight where we are seeing the majority of our cases. So if you remember, early on, so much of our outbreak here in Chicago and the outbreak around the country was being driven by what we call congregate settings. Settings where we have a lot of people living in close quarters and the potential for spread is high. So long-term care facilities were first and foremost in that, especially where we think about those older folks getting infected. Our jail was a significant concern. We had a lot of cases early on in that setting. We did a lot of work in our homeless shelters, for example. We had a number of workplaces that were large, factory type or assembly line type workplaces that did not have all of the precautions that we now know so well in place. But the difference is that now we broadly have all of those settings in good control. We do continue to see some cases at long-term care facilities. They remain a very high-risk setting, but nothing like what we were seeing earlier. And we have good testing protocols and other control procedures in place that have really taken that out of the list of major concern. And if you look, again, our case rates in those older Chicagoans are much, much lower than they were previously. Similarly, the jail is in very, very good control. We've got excellent testing and follow-up related to people who are experiencing homelessness, and we're not seeing major outbreaks in workplaces. We've learned a lot about how to keep each other safe at work. Things like keeping that 6-foot distance, having the masking, putting administrative controls in place that help protect against spread. Where we are seeing COVID spread in Chicago is in households and in social gatherings. So I thought I'd read you just a few little vignettes to give you a flavor of this, just from cases in the last week or so. A man in his 30s. Case went to a gathering at his friend's house, developed symptoms, and found out his friend was positive. Not a very exciting story, but one that we are hearing over and over and over and over again. Woman in her 40s went to her mom's birthday gathering with a few people, including son, daughter, mother, sister, and niece. Everyone tested positive after getting together at the event. Another woman in her 40s, birthday party with about 20 people at a friend's home, came into contact with someone who tested positive. This is a quote from the case report. Case said they were lax on social distancing because they all trusted each other. This is very common, what we're hearing. Here's one. A neighbor from the subdivision came over for around 20 minutes and they chatted. Didn't sit in the house or anything, but were in fairly close contact and weren't wearing masks. The neighbor tested positive, emailed and let them know, and both the case and the husband were tested and found to be positive. We have a man in his 20s who went to his aunt's house. Multiple extended family members later tested positive. A woman in her 40s who went with a group of friends to dinner and drinks. Later found one of the attendees was positive. We have a family of 4 that was all positive, with a teenager in the household who had hosted a 2-day card tournament with many people coming through the home for this social gathering. We're still investigating this case, but probably as many as 20 people may have been infected just in that setting. So none of these are big, flashy stories. We've not seen major outbreaks that we can associate to one given spot like we could early on. But that is our challenge, because we have the ability to do more enforcement at places like restaurants and bars. We have the ability to put all of the good things in place that have been done to make workplaces as safe as they can be. We have the ability to regulate in our public spaces. But in private spaces, like households and social gatherings, the city of Chicago broadly can't regulate that activity. And those are decisions that people are making on a regular basis. I know that you feel safe at home. I feel safe at home. I know that you feel safe when you're among friends that you know. It's easy to let your guard down, to not wear masks, to not social distance. But the problem is, as we're seeing cases increase, the risk is significantly higher. And as people are letting down their guard, they're out potentially contracting COVID and then bringing it back into households. So our Chicago data, by and large, the #1 risk factor is exposure within the household. It is 10 times the risk of acquiring COVID than any of the other exposures. And so I would ask you all, please, to think about ways that you can limit your close contacts. And by that, I mean the people who you don't keep distance from and you don't wear masks from. Broadly, most people are going to be in close contact within folks within your household. But I would recommend that if someone at very high risk for COVID lives within your household, someone who's older, has a serious underlying condition, and you or someone in your family has had a number of higher risk exposures, hasn't been able to keep that tight, even within the household, you may want to think about potentially wearing a mask or keeping your distance for the 14 days after that significant exposure. I know that's not always possible, but I feel like it's my job to let you know that that is the main setting where we're seeing spread. But beyond that, recognize that when you are out and not being careful, even among your trusted friends and family, you do run the risk of bringing COVID back into your home and into your friends group. So again, we know the things that work to help protect against COVID spread. Some of the stories that have made the biggest attention in the news, you'll remember a month ago or so, there were 2 hairdressers in Missouri who were found to have COVID, and they had had more than 160 contacts. Do you know how many contacts actually ended up developing COVID? 0. And most likely, that's because they had strict masking protocols in place. Masking by itself helps. Social distancing by itself helps. They're best when they're combined. But we would ask people to do your best to think about protecting your friends and your family. Don't take unnecessary risks. If you're out and about, if there's a setting where you have to take your mask off or you can't keep that distance, you are at higher risk. If you need to travel to one of these states, you are at higher risk. So please help us to protect the progress that we've made. We really need to turn these numbers around in Chicago. We want to get back to a point where we're talking about the case numbers decreasing again. We want to get back to a point where we can go below 200 cases a day again and start going even lower and start being able to think about further reopening instead of the space that we're in right now, which is more a space of concern, potentially needing to pull back. We can do this. We've flattened the curve before. We can do it again. And I want us to do it before we see that impact on hospitalizations or on deaths. It's about everybody making individual choices. We know what to do, and now we just need to do it. So thanks very much, and I'm happy to take questions.
Thank you, Dr. Arwady. Could we talk a little bit about contact tracing?
Sure.
There is some information today that says some cities are saying, forget it. It's just not worth it. People aren't answering. There's too many cases. Where does Chicago stand on contact tracing? Is it working?
Sure. So all of those little vignettes I read you were exact quotes from case investigation and contact tracing that CDPH has done in the last week. We are at a point here in Chicago where we've met the required metric by the state where all cases, as soon as we receive the case, we are initiating a case investigation within 24 hours. We have to be at over 90% of those, and we have met that. That said, we are having challenges like many other states and cities are. We initiate that case investigation, but we're having problems with people not picking up the phone or hanging up or being unwilling to give information. We're working on some updates to our technology behind the scenes that will, for example, let us have a single number that it is clear that when someone is calling from this number, it is related to contact tracing. Give us the ability to do more text messaging. We find younger Chicagoans in particular not very interested in having telephone conversations, so we've been working on building some texting and sort of other ways of getting data that perhaps particularly people in this 18 to 29-year-old group may feel more comfortable sharing data. And what's really exciting is we are moving ahead, and we'll have some news really in the next few weeks with the community-based portion of our contact tracing plan. So you'll remember this is the RFP that's gone out with Chicago Cook Workforce Partnership in the lead, and there will be hundreds of people that are hired through community-based organizations to help with the contact tracing efforts. Chicago Department of Public Health will stay absolutely in the center of this, and where there are more complex investigations, for example, in a workplace setting or in a school setting or whatever setting, we stay on that. We're not going anywhere. But our ability to add some of this community-based contact tracing, we think may help in terms of building trust, in terms of giving us other ways to reach out. So I think the last thing I would say is that we do have concerns where tests are taking a long time to come back. When tests take a long time to come back, you lose a lot of the benefit of doing that early contact tracing. And this has not been as much of a problem in Chicago as it has in some other places. But the fact of the matter is that when so much of the country is out of control, we do a lot of the work depends on similar lab networks. So you take your Quest or your LabCorp, these are our large commercial networks across the whole US. They are really overburdened by the hundreds of thousands of cases that they're getting, and it has created some slowdown and turnaround for us here in Chicago. Not as bad as in some other places, but it's a concern. So my feeling is that contact tracing is one of the most important ways that we have similarly around education. We're thinking about the possibility, for example, if people are coming with, especially if we see more problems related to turnaround time, to how much that lab is coming back, we're thinking about once our community-based staff are on board and we have some more capacity, we may start doing contact tracing at the time of testing for people who are symptomatic instead of waiting for a test result to come back. Actually reach out and say, someone that you were in contact contact with has symptoms that may be consistent with COVID, we're waiting on test results, but in the meantime, we need you to keep your distance. We need you to potentially get testing in this setting. So we have a whole list of things that we're thinking about trying, but the fact that COVID does spread quite a bit when people are asymptomatic or before they're symptomatic makes it different from most of the other diseases that we do contact tracing for, and it complicates it. But we're much more on track here in Chicago with contact tracing than many other jurisdictions are, and it's because our cases are at this level. When we were having 1,000+ cases a day, we couldn't stay on top of our contact tracing either. We worked to build our capacity, and we can handle what we have now. We can handle some increase, but if we were to see the really steep increases, we could easily get back into a setting like they're having in Texas, where they're just not able to do all the contact tracing.
From CBS 2, the emergency travel order went into effect in early July. Since then, is there now a concrete plan about how to enforce it or ensure people are following the rules? Or is it still just mainly about educating people about the virus?
Yeah, absolutely. So our primary objective from the beginning and now is about educating and informing the public. And so through this, making announcements every week, putting the information up at airports, making sure people, as they're booking airline tickets, are getting information about quarantine requirements in Chicago, handing out information through hotels and Airbnbs as they're booking, putting the information up on the highways. Most of this has been about education, and in that respect, I think it's actually been extremely effective. We have gotten calls about this travel order, questions at a level that has suggested that people are paying serious attention. We've got a lot of examples of people putting off business travel, for example, if it's not necessary at that point, people delaying personal travel if it's not required. In terms of enforcement, so we have the ability to issue fines, and we've been working, over these last couple of weeks to really nail down what some of that can look like. My primary goal is not to divert a lot of the CDPH resources that I have that are doing the investigations and doing the follow-up to doing some of the very aggressive enforcement techniques that we've seen in other places and frankly haven't worked that well. So I have absolutely no intention of pulling cars over that have out-of-state license plates. I have no intention of developing watch lists of people who are flying in through the airports, particularly because we know a lot of them leave from Chicago. But where we identify people of concern, we are sending warning letters, and then we have the ability to issue fines of between $100 to $500 a day, especially if we were to detect in the course of an investigation that there had been a contact, for example. But the primary goal, I think appropriately, is education, just as it is for mask wearing, just as it is for social distancing. We've instead put resources into things like our social distancing ambassadors, right? We've got 700, 800 young people between 14 and 24 who are out in the parks reminding people to keep their distance, reminding people to wear their masks. We've put additional resources into doing some street teams and outreach, again, for younger people, getting that word out. I am more about making sure people understand the risks and putting resources into encouraging people to do the right thing for them and their neighbor. But if we see egregious examples of this, we have figured out ways to be able to get proof if we need it and to issue citations.
And would that be, there was discussion last week of social media, keeping an eye on that. Are you doing that?
Yeah, so let me clarify that. We do not have somebody dedicated to sitting and watching social media feeds, but if we identify someone of concern, right? We hear about someone who may have traveled or someone we want to follow up on. I, again, do not have unlimited inspector capability. At the health department, most of my enforcement is really around restaurants, bars, food establishments. I want to keep those folks doing that kind of work. We know those are settings of concern. But one of the easiest ways to sort of get enough proof that there was the potential potential of a violated quarantine order without me having to send out an inspector or do any sort of more aggressive follow-up to collect that, is to look at social media. And so if we learn that someone has potentially violated and they have social media where it's very clear that they were, in Miami or they were in Cancun or, wherever they were, one of the states, wouldn't be Cancun actually because that's not on our order, but they're in any of the states that violated our order, and then a few days later they're in Chicago and they're clearly out in Chicago, not just back, but at a restaurant or at the Bean or whatever it may be, and they're posting about that. That's an example of where we could use that as proof to issue citations. So I don't want to overemphasize that we're somehow Big Brother and monitoring people's social accounts. We're absolutely not doing that. But where we already have a concern, it's one of the easiest ways to identify people who are not just breaking the travel order, but flaunting it publicly.
From Univision, have you had a chance to look at the Lurie Children's Hospital study in regards to young children and their potential to spread COVID? What is your take on the findings? Does this in any way make you rethink the CPS hybrid learning model?
Yeah, so of course I've looked at it. We have a whole team at the health department who are focused on keeping up to date with all of the latest science, and actually particularly around kids at this time of year, we're paying attention. There's been a lot of different studies looking at everything. This one was about level of virus that's been found. There's other epidemiological studies that are instead looking at the risk, for example, of young children under 10. We know that young children under 10 in household and some very large studies out of Korea are about half as likely to spread. Finding virus does not necessarily mean spreading virus. Lots of questions remain in this space would be, my answer at the end of the day. I think we've had a lot of conversations about this, and I'm not going to talk about schools in great depth today. But at the end of the day, for me, the big question on schools is whether our local outbreak is in a place that is well controlled, and whether the schools have the appropriate things in place to help keep that spread down. I'm reassured by the fact that we've learned a lot about how to keep workplaces safe. I think we've learned a lot from seeing schools that have been open in other settings around the world that have managed to not see significant spread with those open. We have seen some examples, like Israel would be an example, where they opened, didn't necessarily have all the masking in place, et cetera, did see spread. So it remains a point with a lot of research. Every time there's new studies about, we add it to what we know. But I do consider, education, I think we all consider education essential. And thinking about what that should look like will be a local decision based on what our local outbreak looks like. And, our numbers are on the way up, so I have some concern there, and whether we can protect children as best we can. So it's a major topic of conversation, but that single study does not change my overall opinion on schools.
And so today, I'm sure you get plenty of friends and people. What do you say to them? Yes, school will, that's a great idea, send your kid.
So what I can say is that I've not asked my sister if I could speak about her, so maybe I shouldn't publicly. But broadly, yes. Where people are asking me, I say it depends on what your local outbreak looks like, right? And so if you live in Florida or Texas or Mississippi or Los Angeles, no. Your outbreak is not in control. It is not in a place where schools should probably be open. If you live in New York City, your outbreak's in very good control. And so it depends on what your local data looks like. And if the outbreak is broadly in control, I'm a pediatrician, and I feel pretty strongly that there are benefits for in-person education, especially for younger children who don't learn well from screens, and all of the social emotional benefits and all the other things that we've talked about. But it all comes back to what that local data looks like. And, plus obviously all of the input from stakeholders and decision making there. But on the science side, my biggest question is, what does your local outbreak look like? But where people ask me, I have an option, for example, I personally am in favor of having children in school.
There is a bit of a mixed message, because today you've also talked about generations. So your child goes to school, perhaps lives at home with someone older. The child wears a mask all day at school, comes home and wears a mask at home too?
Yeah, so this is where recognizing whether the child is at school wearing a mask with the social distancing, with the appropriate procedures in place, I honestly do not think the risk of spread is significant. I wouldn't be promoting this if I thought it was. I think that we've done a lot of thinking about how to do this as safely as possible. Those pods, the distance, like all of these things are in place to keep the risk of spread down at school. And so as long as children are broadly able to follow that, they should not be bringing additional risk back to their household. And that's part of the thinking on that. I can't say the risk is zero, of course, right? And again, the more our numbers are going up in Chicago, the more concern I have about this, because as our cases increase, the risk of people having COVID, especially asymptomatic COVID, does go up.
From ABC7, a group of restaurants at the Fulton Market are asking that the city distinguish between restaurants and bars when it comes to the COVID restrictions. They want restaurants to be able to have 10 people at a table, not 6. And say they're being unfairly punished for the bad behavior at a few bars. A letter is being sent to the alderman and the mayor. Is this something that would be considered, and if not, why not?
Not a chance, not right now. Not as numbers are on the way up. We dropped that number of people who can eat together from 10 to 6 at the same time that we from 10 to 6 within the indoor setting in the restaurant, at the same time that we closed indoor capacity at bars, places that didn't have food restrictions, food licenses, excuse me. When you are at a restaurant, indoors, by definition, pretty much, the people at your table have just come into your bubble because you have to take your mask off. People are sitting close, they're in those social settings, and we have seen, like in an example of that vignette I read, we have seen examples of spread. So as our numbers have gone up here and we're getting up towards 300 cases a day, that means that the chance of anybody being asymptomatic in a given setting also goes up significantly, right? So the reason we dropped it from 10 down to 6 was because we'd gotten over that 200 mark again and are on the way up. If we keep seeing numbers going up, we may need to pull back on other forms of gatherings. But, those settings where people have to take their mask off, I'm very concerned about. So, having that limit of 6 was where we felt like we could be from a risk standpoint based on our current numbers. We can take that off again when we get our numbers back in better control and we're get back down under 200 and we're heading down in the good direction. In the same way that on the travel restriction here, right, we're talking about being able to take it off 3 states. When things are under control, that's the setting where you can loosen restrictions. But in the meantime, that 6-person requirement for indoor dining is appropriate and will remain in place.
Is there anything, this is my last one, is there anything on the East Coast they're doing that we're not doing? How, because of all that population, high density, why are their numbers better?
Yep. So one of the most important things I would say is that we are more open than they are. So to this question, broadly, to this question of restaurants, for example, New York City still does not have any indoor dining at restaurants, right? They've been much more restrictive in terms of what has been allowed to open. And that has, in part, I'd say that's part of it, allowed them to be in tighter control. We've felt like here we want to keep our outbreak, obviously, in good control, but have balanced that against a lot of the other economic and social needs. We wanted to be able to open museums with limited capacity. We wanted to be able to open our small businesses, our restaurants, our bars. So we're playing this balance game a little bit. We are, to my knowledge, the most open big city in the country right now. So, Los Angeles, Houston, they've all had to completely back off in terms of, closing many restaurants, things that were open before. Some of the places in the Northeast have been more restrictive and are somewhat more in control. I hope that we don't need to move to those more restrictive methods that we've seen in the Northeast. We would do it, though, if we saw significant increase or we were getting up toward that, toward higher higher numbers there. I also think that the Northeast, New York in particular, just had such a bad outbreak the first time around. So sometimes I hear people say, oh, you know, we've had a lot of deaths here in Chicago, which we have. We've had, more than 2,700 deaths in Chicago. We've had about 1 in 1,000 Chicagoans die of COVID. But you compare that to New York City, 1 in 370 residents of New York City died of COVID, right? 3 times, even more, the death rate that we had here. And some of that is due to, that's another whole, we could talk about the differences there. But I think where you've had a region of the country that got hit so much harder than we did here in Chicago, it leads to additional probably fear and more tolerance for more of these restrictions. You've also probably had more people exposed overall. But there's a lot of factors that go into it. But I think by and large, they are also taking the precautions seriously. We're not seeing all of this political debate about mask wearing broadly in the Northeast like we are in the South and in the West. I think they are, as we have been here in Chicago, really letting science drive the decisions. And I think we're seeing some of that success there. So some of that success is the result of the very dramatic outbreak that they had earlier. Here, we had a big peak in May, but nothing like what was seen out east. I don't want to ever get to a point where we're talking about anything like was seen out there. And right now is the time to turn that around, especially in these social settings. I'm worried about it.
Thank you. Thank you.
Thanks.